Hello everyone, my name is Derek Sargent. I'm going to talk to you briefly about intermittent fasting for cancer rehab and prevention. Alright, first off, let's talk about cancer. What is it and what causes it? So as we age, our healthy cells divide and replace each other in an organized fashion. Uh, Cancer forms when a cell is somehow altered and starts to multiply out of control while disrupting function among normal healthy cells. There are many different types of cancer, and the disease can become very dynamic, so the exact cause is unknown. However, there are many risk factors associated with the disease that can be prevented through a healthy lifestyle. Next, let's look at how a cancerous tumor grows and spreads. So cancer cells need fuel just like any other cell. So a cancerous tumor actually forms blood vessels, which is called angiogenesis. So they can get oxygen, glucose or sugar, and hormone supply. They also feed off the other tissues and become invasive. All right, and treatments. So you can remove cancer surgically. You can combat it through drugs or chemotherapy, radiation or radiotherapy, and possibly intermittent fasting. And talking about prevention, like I mentioned before, cancer can be prevented through a healthy lifestyle. So there's evidence to show that a whole foods plant-based diet can help prevent the disease. Obviously avoiding tobacco, regular exercise, and keeping a healthy body composition is important to the prevention of metabolic diseases. Now let's transition into what is intermittent fasting. So intermittent fasting is just an eating pattern that includes periods of eating and fasting, or starving. There are multiple methods of intermittent fasting. It's become a fad diet, unfortunately, but it is an effective way to lose weight over the short period. So just as a disclaimer, I'm not a medical professional, so I recommend you all consult a medical professional before considering intermittent fasting. So to elaborate on intermittent fasting, I just want to talk briefly about the benefits. So like I discussed before, there's a lot of risk factors for metabolic disease that can be prevented through a healthy lifestyle, and the right type of intermittent fasting, right, based on what your medical professional recommends, can have a lot of benefits for the body. So with the increased fat metabolism, this helps stimulate and improve brain function. Can possibly help prevent cancer. So a lot of the studies that I read were mainly animal studies. So not a whole lot of studies on humans yet for IF and cancer rehab and prevention. So like I said before, it can also promote weight loss over a short duration. Studies have shown that it improves heart function, boosts immune system, and more importantly, improves glucose tolerance. All right, now looking at the link between obesity, metabolic syndrome, and cancer. So we know that Americans generally have a pretty poor diet, right? When looking at the spectrum, the standard American diet is way on the left, whole food plant-based, way on the right for preventing and reversing disease. So we know, right, there's plenty of evidence out there showing that the standard American diet is a major predictor of obesity and other metabolic syndromes. In addition, some experts actually consider cancer as a metabolic disease. And as mentioned before, there are many healthy lifestyle behaviors that can help prevent the disease. So the theory. So intermittent fasting, right? Looking at human evolution, we haven't always had access to food. Uh, so people have, uh, not on purpose, but starved and fasted over time, uh, creating an environment that changes the DNA in our genetics. So some experts think that fasting is ingrained in our DNA and something that uh, maybe we should practice. Uh, when looking at benefits associated with cancer rehab and prevention, IF creates stress on the cells. This stress creates resiliency against oxidative stress and disease. Intermittent fasting is also shown to reduce body fat, like I said before, improve insulin resistance, and decrease those other risk factors that are associated with cardiovascular disease. All right, to conclude, again, there are many benefits of intermittent fasting. Um, like I said before, it can be a sustainable way to lose weight um, if monitored by a clinician. Please don't go online and follow the fad approach. It can be pretty dangerous. Furthermore, intermittent fasting, again, has shown to reduce risk for cardiovascular disease and other biomarkers of disease. But ultimately, intermittent fasting for cancer rehab and prevention needs more research, specifically more studies done on humans rather than animals. Dun, 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 beep, beep, beep.